Okay, this is a teaching video intended to give a how-to on how to look at how to create 2D multiplanar reformats through the scaphoid, because this is a common request from surgeons, particularly if a patient's had a scaphoid fracture. This is the scaphoid here, and we're going to look at how to do that and how to provide images that they like, and they're also helpful to the radiologists as well. So normally we acquire our axial images just however the patient's on the table, and it might, as you know, result in sort of oblique looking images. The orientation may be odd, but that's okay because we acquire thin section data so that we can go through this MPR process to create the images that we want in the appearance that we want. So the key here is to notice that the scaphoid has an unusual sort of comma shape. Okay, it's sort of curved, but it's longer than it is thin, so it's sort of tubular looking. And if you look on these sagittal reformats, these are ones that are just done based on the tabletop position. This is the capitate bone, this is the scaphoid. As you scroll through it, this is the distal pole and the proximal pole, but you see how it's never on one image. It's all, you have to scroll through it to get a sense of the bone and the shape of the bone. Well, that's what the surgeons want to avoid. They want to be able to see that bone essentially on one image along the orientation of the scaphoid in order to see it and evaluate it. So how do we do that? Well, first of all, we try our best to determine what we think the axis of the scaphoid is. So this is sort of what I would say is bisecting the long axis, the long part of the bone. And so I want to change my reformat plane to be along that axis. And you should note that this could change from person to person depending on their wrist position at the time of scanning. So don't count on a particular angle. You just have to look at the bone and create that line along that axis, okay? And then, of course, you can kind of cone in, because really what we're focusing on is the scaphoid itself. I wouldn't just get the scaphoid, get a little bit around it, but you don't need to cover the whole wrist. Okay. Now, if we go back, having done this, if we look at the sagittal plane, you can see that the scaphoid is more in one image plane. It's still not perfect, but it can be seen more easily on a single slice. And what you can do to help this is kind of go back and forth between the coronal and sagittal and reformat now the sagittal along the long axis of the scaphoid like this. Okay, you see what I'm doing here? So this is sort of the long axis of the scaphoid. And then I can go back to the coronal and see, now that I've done that, have I picked the right angle? Well, maybe I could make it a little more angled like that. Okay, and now when we look here and I scroll through the sagittals that we've made, you can see that you really see the scaphoid basically all together on one image. That's what the surgeons are looking for, and that's what you're trying to create with your images. And this would be the most important thing you're going to produce from doing this. I would also produce the coronal images, which look something like that. That's also useful, but the most important are these sagittal images that look just like that. You know, you can even bring this in more. You can bring this in more so that you don't cover too much, but that is what they're going for. And this way they can assess the morphology of the bone, whether it has a so-called humpback deformity, and look at any fractures and how they're healing.